All right, folks, you've all heard of the drug Ozempic, I'm sure. It's ubiquitous, it's a dime a dozen these days. But what does Ozempic have to do with surgery? Specifically, what does it have to do with plastic surgery? What I'm about to share with you are several very important things that you need to know, especially if you are on it or a friend or family is on it, before you ever have surgery. One of them may actually cause death. Hi everyone, I'm Dr. Amir Karam, board certified facial plastic surgeon and founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we're going to talk about important safety things you need to know if you're considering having any type of surgery and you're on Ozempic. And I don't want you to be dependent on what the surgeons know or what the surgical center know. Because as we all know, sometimes people don't keep up with the medical literature, and as a result, you get the blunt end of it. Ozempic has come on the scene. You don't need to introduce it too much more than to simply say it's a hormone-like drug that is stabilized in the body. It works by giving the body a sense of fullness, satiety. So you give it to people who are trying to lose weight, and suddenly they're not as hungry, as they were before. They eat less, they get full faster, and ultimately they lose weight. Sounds really great. Now, it wasn't designed for this purpose. It's become super popular for this purpose, but that wasn't what his initial purpose was. It was a diabetes type of a drug. So what ends up happening in this case, and we don't need to go into the mechanism of how it works with diabetes versus how it impacts weight loss, suffice it to say that it's being used off-label very commonly for this purpose. And as a result, in my practice, I'm not exaggerating, I think maybe a third of the patients that I see for surgery these days are on Ozempic, which means that there is probably equal number of patients or more that are out there who are having any type of surgery, whether it's plastic, facial plastic, something that's non-elective, etc., and they're on it. And why it's so important to know the list of things that can cause real issue, not only so you can avoid them, but also so you can inform your medical team that you're on it in case of an emergency. Sometimes you don't have the opportunity to plan ahead. Sometimes things happen. You get in God forbid, a car accident, or you're in some type of serious immediate situation. It's important to know this and know that this is an important drug to mention during your preoperative assessment in any setting. All right, so let's discuss. I'm gonna go from basically most common scenario that you guys think, and the first one has no real danger, but it's a question that a lot of people want to know. And they've heard about this concept of Ozempic Face. The concept of Ozempic Face. Does the drug Ozempic make you look older? Does it age you? Well, here's the deal. The drug in and of itself doesn't accelerate aging, like as it's turned on the mechanism that makes your jowls and neck sag, etc. However, what ends up happening is, because you lose a lot of weight at an age where most likely you're probably coinciding with some natural aging changes that are happening at the fascial level. When that weight comes off and that scaffold gets kind of eliminated, all of a sudden, what do you see? You see the face shrink down. When the face shrinks down, it's not holding up anymore and everything starts to sag. We see that with Ozempic. We see that in patients who just happen to lose a ton of weight. There's a whole subspecialty of plastic surgery, like bariatric reconstructive type surgeries, where people lose massive amounts of weight after being morbidly obese and their whole body has to be lifted, etc. Well, the same thing happens in the face. So I made a whole video on this before, and I told you all that just because you lose volume in the face, that the treatment for it is not to put more volume back. It's not like you go get a fat transfer, a bunch of fillers, and you're back to square one, but yet your body has lost a lot of weight. Once that has happened, the reality is that's the fascia that's lax. You need to lift it surgically. So the answer to Ozempic Face, when that happens, when you age post Ozempic use, is you're probably due for a lift, whether you like it or not. It is just what it is. I'm just giving you out there. So keep you out of trouble of going and getting a ton of fillers and things like that and end up looking like a chipmunk and still looking old, still looking lax, and spending a ton of money on those type of things when ultimately just a vertical restore or some other type of a lift with some other surgeon would solve the issue for you. Now, I consider that a relatively small issue. Right? That's not a big deal. Well, it might be a big deal to you, of course. It might be a big deal to anyone who suddenly, in a matter of a few months, suddenly looks like 15, 20 years older. It's not a light matter, but it's not life or death is what I meant. What I'm about to share with you, the handful of things that can cause serious complication, And this is nothing to do with plastic surgery per se. It has to do with just in general post-surgical when patients are on semaglutide, which is the active compound in Ozempic. So here's some of the things that can happen. Number one, you can have a problem with wound healing. Now, don't ask me exactly what that means. I mean, it could mean a number of different things. Your wounds don't heal right. You could have a breakdown of the incision line. You could have problems with necrosis, meaning that some of the skin around it dies. I mean, there's a number of things that categorically fall into it, but it's been known that this particular compound, when it's used postoperatively, can cause issues with wound healing. So that's very important to know, because you obviously don't want to go into, especially an elective surgery like a facelift, and have problems with healing your wound. I mean, we do everything we can to avoid problems post-surgery. So know that this is a thing. And I think surgeries like facelifts are actually probably even more susceptible, things like facelifts and abdominoplasties, where skin and tissue is removed and then it's brought together. And depending on how that technique is done, sometimes it's under tension. So if you're affecting wound healing, you're gonna have an issue. The second thing that can happen is increased risk for infection. Now, this is again something that's been shared and shown in the literature, that patients who are on these particular compounds have a higher chance of infection postoperatively. Now, infections are no joke afterwards. I mean, you can have a number of different types of infections. Some of them can be requiring, in-hospital stays and keeping you in an ICU even, because it's multi-drug resistant. It could be a number of different scenarios, but you definitely don't want your immune system to be decreased after a surgery. You want your immune system elevated and up. Now, whether that has an impact on cold and flu season or any of that kind of stuff, I don't know the answer. I just know that wound infections postoperatively do go up in patients who are on Ozempic. That's really important to know. The next is hypoglycemia. So remember, this is a diabetic drug, so you're using it to decrease blood sugar levels in a patient with diabetes. So say somebody that doesn't have diabetes gets this, well, they're gonna have problems with their blood sugar potentially crashing. That's a big problem after surgery, because your body already goes into a state of inflammatory healing, etc., which can tend to drop the blood sugars in some cases anyway. But you couple that with the fact that, maybe you're using it, you're totally normal, you're run a little bit on the low side anyway after surgery, you fasted, etc. Boom, your blood sugars drop. Now you're running into issues with all sorts of medical conditions, even coma and altered mental status, which would end up causing you to be admitted to the hospital and having all sorts of workups done and treatments done to try to elevate your blood sugar and rule out everything else that could be causing a mental status change postoperatively. Things like stroke and heart attack and infection and shock and everything else. So know this, very, very important, that they can cause hypoglycemia. This last one is the one that is probably the most, I would say, important, because it has an immediate impact on the surgery you're gonna have, without a doubt. So there's no way around this one. And this one is actually one that could kill you. I'm not trying to make this overly dramatic, trust me. I mean, just in the last week or two, I've read, because I get all sorts of literature that comes to my inbox, and read tons of reports throughout the country of people who have died postoperatively while on Ozempic. And here's why. If you've ever had surgery, whether sedation or general anesthesia, you've been told, to hold food and water for 8 hours. Generally speaking, mostly for general anesthesia, although we make those same recommendations for IV sedation. But I'll explain why it's not as critical as it is with general anesthesia. Although if you have the opportunity, you should make the rules that I'm about to share with you, make them part of your elective schedule. So here's what it comes down to. One of the things that happen with Ozempic is that it delays food from leaving the stomach, right? Makes sense. I mean, if you have food left in your stomach after you've eaten for, a whole day or whatever it is, even the next day, you're gonna be a lot less hungry, because the stomach responds from emptiness makes you feel hungry, and as you fill it up, it makes you feel full. So what happens is, in the earlier stages of this, no one really understood exactly the impact of this. So you treated a patient who's on Ozempic the way you treat everyone. You say, hey, stay off of food and drink for 8 hours before your general anesthesia procedure. So the person eats a meal at night, comes back the next morning for their elective operation. what ends up happening is they go in for surgery and you go under general anesthesia. In the act of putting somebody under general anesthesia, the intubation part of it, where you're putting this tube down their throat, the anesthesia causes the body to fully relax, basically in a state of paralysis, because how else are you gonna sneak that endotracheal tube past the vocal cords and comfortably do it without the patient like thrashing everywhere, right? So you put them in a state of paralysis, which relaxes all the muscles in the body, including the muscles of the esophagus and the sphincters of the esophagus. So what happens is, if there's food in your stomach, it will make its way back up the esophagus and come right up into the transition between your throat and the voice box, the larynx, where it's the gateway into your lungs. And that food will then creep into the lungs. So it creeps not only the food, but also the stomach acid and all this kind of stuff, which has no place belonging in the lungs. When this happens, it creates a condition called aspiration pneumonia. Aspiration pneumonia basically results in about 50% of the people who get it end up admitted to the hospital on high-dose IV antibiotics, potentially intubating them, and an unfortunate number of them pass. I mean, the damage to the lung, the acids and all that stuff that's in the stomach, again, the stomach is made for that, the lungs are not, creates a chemical injury to the lung, and as a result of that, sometimes the damage is too great, depending on the level of aspiration. So what has happened recently is a number of patients have, throughout the country, have gone in for elective surgeries. They had a history of Ozempic. The anesthesiologist didn't make much of it, told them to stay off of it for 8 hours, did the operation. Next thing you know, their post-operative condition is sinking, their SATs are dropping, all this kind of stuff, and they do x-rays, et cetera, and they find that they have aspiration pneumonia. They get admitted, and like I said, an unfortunate number of these patients have died. The reason why that 8-hour rule exists is to clear the stomach. If your stomach isn't cleared, then all bets are off. So here's the take-home message. If you're on Ozempic and you're going under a normal 8-hour type of fasting schedule, it's not enough. You need to explain to your anesthesiologist, you need to explain to your surgeon that you're on it. And if they have no idea like why that is even important, you need to explain this. I mean, look up some studies and share it with them. But what has to actually happen, the current recommendation is, and this just is literally changing every few weeks. The last I checked was about a month ago, and it was 2 weeks before surgery, you need to stop your Ozempic. Now, 4 weeks before your surgery, you need to stop Ozempic. And the reason is because the molecule actually lingers, has effect on the body for up to a month. Even though a lot of people end up using it on a weekly basis, yeah, there's a peak and whatever, but there's some impact from the drug that can last up to a month, 3 weeks at least. So as a result of that, the proper thing to do is get off of the medication well ahead of your surgery and move forward with the elective operations. Now, the reason why I made the caveat between sedation versus general anesthesia, well, general anesthesia, as I said, is a tube going down. IV sedation, especially if it's light IV sedation, not heavy IV sedation like in the case of colonoscopy or some other bigger sedation level, but just a mild IV sedation, well, you're not regurging, unless you have a history of gastroabdominal reflux, you're not regurging the way you normally, and plus you have a cough reflex intact, so you can, the second you feel some of that, you would cough and clear. It's not to say you ideally would want to stay off of it for longer periods of time, but if you aren't, it doesn't have the same implications as it does with general anesthesia, but I don't want that to become like a point of, okay, I'm gonna stay on it because I'm having IV sedation. We ask all of our patients, whenever we get an opportunity to keep them off of it for that period of time, we ask them to do that. So now, this is all for elective. If it's an emergency situation, make sure your family members know that this is the deal so that they can inform the doctors so they can do whatever they need to do. Sometimes they can do an awake intubation, they can do certain modifications to help decrease the risk of aspiration. All right, my friends, that is some good knowledge to share and good knowledge to really take into heart and remember, because even though it might not be something that's relevant at the moment, it could be relevant down the road. So make sure you share this with some friends and family. If you enjoyed this content, please hit like. It does a lot for our channel. If you haven't already subscribed to the channel, you'll get these videos once a week. We do an amazing job of trying to stay consistent so that you can enjoy this type of high-level, empowering, accurate content that'll help you through all sorts of facial rejuvenation, skin rejuvenation topics. And if you want a little bit more, follow my social media, Instagram, TikTok, etc. If you'd like to read some really nice newsletter articles that I curate myself, follow Karam MD Journal. There's a sign up down in the list there. Get signed up so once a week you get a nice journal article sent to you spot on information, cuts through the clutter, helps you understand everything. All right, folks, hope you enjoyed it. Hope this was helpful. If you have any questions or comments, drop them below. Thanks so much. Until next time, Dr. Karam.